Hello and welcome to Deacon's Virtual Open Day. My name is Dr. Hayley McKenzie and I'm a lecturer in the School of Health and Social Development and the course director. I'm thrilled to have you with me as we explore the Bachelor of Public Health, Health Promotion, and also the double degree Bachelor of Public Health, Health Promotion, and Bachelor of Commerce. We'll also be hosting a live Q&A session after this information session to answer any questions that you may have. You can start writing your questions in the panel on the right-hand side of your screen, and these will be responded to during the live Q&A session. I'd like to begin with an acknowledgement of country. As we gather for this meeting, physically dispersed and virtually constructed, let us take a moment to reflect the meaning of place, and doing so, recognise the traditional lands on which we do our business today. I would like to particularly acknowledge the Wurundjeri people of the Kulin Nations, the traditional owners of the land on which I'm presenting from today. We acknowledge the elders, past, present, and emerging of all the land we work and live on, and their ancestral spirits with gratitude and respect. So we're going to cover quite a bit in this presentation today. So I'll start with an overview of what public health is and what health promotion is. We'll then move on to some more specific information about the course, including the structure, opportunities, pathways, career options, etc. And then throughout, I'll also highlight what Deakin has to offer in terms of learning resources and support that potential future students can access. So Deakin has been the #1 university in Victoria for student satisfaction 12 years running. So it's good to know when you're looking at Deakin that it has a great campus culture, both for our online students and students at our physical campuses. Your online experience is important at Deakin. We have over 40 years of distance and online learning excellence and Australia's top-rated tech support. So investing in your digital skills now will ensure that you're ready for what comes next. So while you may not be studying online, many units have teaching materials and resources that are offered online, and therefore you'll have great access to support to access all this online material. Let's start with looking at what public health is. So public health is concerned with the big picture. The World Health Organization defines public health as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. So public health is important because it is population focused. It aims to detect health issues early and eradicate diseases. It also aims to influence and inform government policy. So again, it's that big picture approach. So some of us are big picture thinkers, and this may be you. So this is looking at population level health rather than specific individuals. So this big picture thinking looks at the pattern of health and disease within the population. In the era of COVID, we can look at the importance of the role of public health. So for example, by looking at statistics and patterns and trends to identify where the virus is spreading, for example, so in terms of numbers, and also what's happening then nationally and also internationally as well. We can also look at the public health messages, so as seen on the slide here. So public health is having the knowledge and skills, but also being able to communicate these to the general population as well. We can then use this data to explore and understand the impacts on health. So the pandemic has really highlighted the importance of public health and the need to educate people about public health, and also what the various approaches to public health are and the various health issues that public health addresses. So therefore, it's really important to have the skills and the experiences through qualifications such as the Bachelor of Public Health, Health Promotion, to respond to these current public health issues. The use of public health data can also explore similarities and differences between diseases and health issues. So for those of you interested in that big picture approach and thinking, public health could be a great match for you. So this includes looking at those upstream efforts such as policy, priority health areas at the policy level as well. So, and this plays a really important role in the area of public health. So if we move on then to health promotion. So while, as I mentioned, that public health is big picture focused, others may like to work more downstream around individual and community health. So the World Health Organization defines health promotion as the process of enabling people to increase control over and to improve their health. Health promotion practitioners, they're responsible for the planning, for the development, the implementation and the evaluation of programs, of projects, of policies. And so this course covers all of these different skill sets. And so many of our students aim to be agents of change, and they learn the skills to enable this throughout their degree. Health promotion program and planning covers many different health issues. So for example, issues in food insecurity and increasing access to nutritious food, the needs of vulnerable populations, increasing physical activity, improving mental health and well-being, just to name a few. So it's looking at what works and what doesn't, and what's the evidence around various health issues and population groups. So with health promotion, there's great variety in the areas in which people can work. So whether it be health issue related or working with a particular community group, it really can come down to what your passion is and how you want to use your knowledge and skills that you gain from this degree. And so that then leads us to the point of making a difference. So in the world of public health and health promotion, you'll never be bored. There are always new challenges arising. And challenges are they what change us, help us, improve us. You'll develop new skills, new talents, new ability, new understandings. And so if you like to help others, then this may be the course for you, because you work to help others at various levels, at that individual, community, population level, in terms of improving and enabling them to improve their own health and well-being. So now that we have a bit of an understanding of what public health is and what health promotion is, we can look more specifically at the course. So the Bachelor of Public Health and Health Promotion is a 3-year degree when studied full-time. So the course comprises of 24 credit points. 16 of these are core units, and the remaining 6 credit points are then electives. And so electives are give you the option to then choose units that you want to do. So these can be whether they're from the Faculty of Health or even other faculties within the university, depending on what your interests are really and how you want to shape that aspect of your degree. So this is what your course would look like if you were studying full-time. So in your first trimester, in your first year, you'd see that you would take the units Understanding Health, Disease Prevention and Control, and Local and Global Environments for Health. And then you would have that elective where, so you might, as I said, choose something from the Faculty of Health, or you might pick something, another area that interests you. You can look at how you develop your skills and knowledge over time. So in the first year, it's really about that becoming inspired. What's your passion? You're going to be introduced to lots of different health issues, to various population groups. What can you take from that in terms of where you want to go career-wise? In the second year, it's all about carving out you. Where do you want to take your degree? What do you want to become known for? And then that final year culminates with the experiences that you get. So by the time you graduate, you'll have the ability and the confidence to take on a whole range of work options and opportunities in the health-related fields. So you can see from this course map here what the core units are, so those core units in blue, and also where the practical experience is embedded within the course, keeping in mind as well that all units aim to have authentic and practical learning and assessment. If we then look at the course structure for the double degree, so the combined degree of Public Health, Health Promotion and Commerce, this is a 4-year degree when studied full-time. And so this course comprises of 32 credit points, 16 of which are core units for Public Health, Health Promotion, and 16 are core units from Commerce. So this is what your course would look like if you were studying full-time. So in your first year, you would be taking your two commerce units, so that accounting for decision making and fundamentals of finance, and then also your 2 health units, so understanding health and disease prevention and control. Again, you can see where that professional experience is embedded over the course of your unit. And there's no electives as such in the double degree as there is in the single degree. Rather, the choice comes from the major that you choose from the set of commerce majors. So for those interested in the double degree, you get to pick which commerce major that you focus on. And so these commerce majors include accounting, economics, finance, financial planning, human resource management, management information systems, and marketing. And so many students who graduate with the double degree, they really appreciate that mix of commerce and health and the unique skill set they get depending on which major they pick and how they combine that with their health units. So as I said, in that first year, it's all about becoming inspired. So you can start to think about those different options available to you and discover what your interests are, what your passions are, and start to find the best fit or the best area for you. So for example, these are a range of interviews of people working in different jobs related to this course. So some are actual graduates of the course as well. And so there's a range of stories within these interviews and tips and hints for getting the most from this degree. And it's a time, that first year, it's a time for thinking about what you like doing and what you do well as well. So some of these are also stories from our alumni and the workforce in terms of options for career pathways and options for students. So you'll see there, there's work being done in Indigenous health, refugee health, at working at the local council, healthy aging, environmental health, which is on the radar more these days in terms of climate change. Research is also another option, given that we draw on an evidence-based work to guide future public health and health promotion. So these resources are available when students enroll in the course to get you thinking about where you may like to end up once you graduate. So Deakin Talent is a great resource that students can draw on to really work on being known in the field and how you want to be known and what you want to be known for. So really in terms of how you're able to present yourself in the public health and health promotion field once you graduate. So Deakin Talent programs and services, they're designed to empower Deakin students to build a career that aligns with their interests, with their values, with their passions, their skills, and enable employers to recruit Deakin graduates. So you can really take advantage of these services as a Deakin student in terms of support around resumes and job applications, around networking events, career coaching, etc. There's so many great resources that you can access throughout your entire degree to make sure that you're really prepared once you graduate in terms of finding employment. As I mentioned, there's various practical experience throughout the course. One in particular is the health practicum. So the health practicum unit enables you to incorporate a fieldwork placement as part of your studies. So it gives you first-hand experience from professionals in your field of study, increasing your employability, and really allowing you to gain valuable transferable skills that will help you succeed after graduation. So this particular unit, it's 120 hours in the field, and you have a mentor that you work with over the course of the trimester. The placements are very diverse. So the organisations that students go to, the projects that they work on are very different, and they're matched to student interests. They change from year to year, but we try and have a really good range of projects and organisations to suit the needs and the interests of all students undertaking the course. So students generally take this unit in their third year as one of their final units in order to really draw on all the skills and the knowledge and the theory that you've learnt in your previous 2 years that you can then apply out in the field. We've had students gain employment from their placement, which is a really great outcome for this unit as well. So for those of you who go on and enrol in the course, you'll have access to these resources which are from the alumni and experts in the field. So they really discuss the qualities that people need to have to succeed in the health field. They include job titles, potential employers. So as I mentioned before, there's great resources that students can access all throughout their degree to get you thinking about your career path once you've finished. Job growth in the sector continues to increase given the importance of health and how it links to all aspects of life. And this has really been reflected in the past few years, hasn't it? And the importance of individual, community, and population level health outcomes. So this includes the need to address health issues. So for example, obesity, heart disease, diabetes, food access, sedentary lifestyles, aging populations. And these can affect healthcare systems globally. So it's also looking at various vulnerable and/or community groups and what their needs are as well. So the work opportunities are vast, and it really depends on what your passion is in terms of where you could take the skills and the knowledge and the theory that you learn throughout your Bachelor of Public Health, Health Promotion, or the double degree with Commerce. So in terms of career outcomes, good to start thinking about what they are. So some examples of job titles include Health Policy Officer, Health Promotion Officer, Program Evaluator, Women's Health Officer, and then you'll find employment in a range of health areas as well. So for example, social inclusion, women's health, healthy eating and nutrition, mental health, for example. And so the variety here is great, and that's something that you can really take away from the presentation today and thinking about the direction that you want to go and where your interests lie. And so these are really powerful positions to be in because then you're that agent of change. You're trying to improve the health and well-being of communities and populations and really enable individuals to take those steps in terms of improving their health and well-being. As I mentioned, the health sector is growing, so it's a great time to be looking at a course such as this in terms of job prospects at the end of it. It's encouraging to see so many opportunities out there which have continued to rise over the past few years. So the graduate outcome survey shows positive feedback from students who have undertaken the course. And so this includes those around teaching practices and also skill development. So all our teaching work at Deakin is informed by active research. So most of our lecturers and teachers are researchers or practitioners who have joined us from industry. So they have lots to offer in terms of their knowledge and their experiences. In the School of Health and Social Development specifically, we have people who are studying Aboriginal and Torres Strait Islander community health. We have a large team interested in the health and inclusion of persons with a disability. We have research exploring physical activity and its impact on health, and also physical activity for different lifespan stages, so children right up to older adults. We have researchers looking at vulnerable groups, so for example, asylum seekers and refugee families who are experiencing disadvantage. Other members in the school look at gender studies and the impact of gender and health. And we also have a large emphasis on policy and research and the way that policy development can inform health practice in areas such as sustainability, environmental management, as well as multiculturalism, diversity, to name a few. So when looking at different courses, it's good to hear from students who have already undertaken those courses. So here we have some comments from Claire, who undertook the Bachelor of Public Health and Health Promotion. So we can see here from Claire that she really enjoyed the diversity of the course and the opportunities that arose because of this diversity. Claire also highlights the practical experiences that she was able to undertake during her course, including the practical unit, which she was then able to gain employment from, which is a great outcome. These comments are from our double degree student, Savannah. So here she highlights the compatibility between the double degree units, so the skills that she got from her health units and her marketing units, and the skills that she has due to this great combination. So Savannah also talks here about being a mentor, and this is indicative of the support that you'll receive from Deakin, in that there are plenty of resources and sources of support that you can access throughout your degree in order to succeed. I want to highlight the Deakin Health Promotion Society. They do great work in terms of fundraising and awareness of health promotion. So the Society strives to build a network for its members by connecting them with like-minded students, with health academics, those in the workforce, and also volunteer organisations. So you can connect with this group in order to build on your skills that you're learning in your degree. It's also a great addition to your CV. And it's also just a great way to connect with other students in the health promotion space. You can gain health promotion experience at Deakin. So for example, we have led the way in becoming a smoke-free environment. So in this particular space, you can look at the public health and health promotion work that went into this, from the groundwork with peer education, including the work of the Deakin Health Promotion Society, to the workplace systems that are in place now as well. COVID-19 had unfortunately put a halt to things such as study tours, but with things opening up again, study tours will again become an option for students to take as an elective. So study tours such as this are a great way to learn about public health and health promotion initiatives that are happening in other parts of the world. It enables students to really build and extend on their knowledge and skills to be a health practitioner on a global scale. People come back from that experience really empowered for the next stage of their career. They're really able to reflect on the importance of place, of different health systems, of culture, of society in general, and what this means for the health of communities and populations. So a great opportunity for students to take during their course. There are professional accreditations that students are eligible to become a member of. So for example, the Public Health Association of Australia and also the Australian Health Promotion Association. Both the single Bachelor of Public Health Promotion and also the double degree with commerce are accredited by the International Union for Health Promotion and Education. So this is a global, professional, non-governmental organisation, and it's dedicated to health promotion around the world. So this is great for those looking to undertake this course as you graduate with this health promotion accreditation. So it's a fantastic asset to the course. In terms of prereqs, all the information you need to know is on the slide here. So it's important to note the different durations. So for the Bachelor of Public Health Promotion, it's a 3-year course. For the double degree with commerce, it's a 4-year degree. You can also look at the different campus offerings. So the Bachelor of Public Health and Health Promotion is offered at our Burwood campus, Geelong campus, and also Cloud, so our online campus. The Bachelor of Public Health and Health Promotion Commerce degree is offered at the Melbourne Burwood campus and Cloud online campus. So there's also those various prerequisites for if you're a school leaver or a non-school leaver there as well. There are various pathways for people entering the degree. So if you're joining today as an international student and you'd like to learn more about applying to Deakin, so fees or scholarships or studying at Deakin, you may wish to attend one of the information sessions run by our international study experts. And you'll find these sessions on the schedule page. There's various pathways for people entering the degree, including some coming from school, the workforce, those coming from previous qualifications as well. And so what this means is that we have a really diverse student cohort, and this benefits the learning of all, because being able to connect with others, particularly in the health promotion public health space, really benefits learning and those different approaches to understanding health. For those of you currently in year 11, Deakin Accelerate is a wonderful opportunity for you to get a head start at university. So it's by completing 2 first-year uni subjects while you're still completing year 12. So some of the benefits include boosting your ATAR, being able to ease your transition into uni, and some of those areas that you can study include health practice and research and disability, diversity and inclusion. So you can find out more information through the link there on the slide also. It's a good idea to explore some of the scholarships that we have here at Deakin to find if there's one that works for you. So there's a number of different scholarships available to students, and it's certainly worth exploring what might be available to support you with undertaking this degree. There's also financial support here at Deakin through scholarships and government loan schemes. So I recommend you follow the link on the slide there to learn more about the fees and financial assistance that you could be eligible for. So the Bachelor of Public Health, Health Promotion, it can also be a pathway to to further study. So for example, you might like to pursue a master's degree in areas such as health economics, disability inclusion, human nutrition. You might think about undertaking an honours year, which is a research-based year, and that can then open the door to further studies such as a PhD, for example. So where you take your degree is really up to you. Important to add that this element that the culture at Deakin respects diversity and inclusion. This is what we promote through all our teaching, learning and research. So if we end on some philosophy, if you do not know what you need to do, the world will never experience the results. So think about, are you the solution? And finally, thanks to everyone for joining us today. It's really great to see so many of you interested in the degree. If you'd like to learn more, please explore the resources on this page and across the virtual Open Day website. We also encourage you to stick around for the live Q&A session. You can send through your questions for this session by entering them into the panel on the right-hand side of your screen. If you need to go to another session, that's fine. You can also speak to our experts on web chat at any time throughout the day. I hope you found this session valuable and enjoy the rest of your day. Thank you. Hello and welcome to the Public Health Promotion live Q&A session. I'm Dr. Hayley McKenzie, and today I am joined by a few presenters here. So we've got Cindy Cov, who is a student currently undertaking our double degree of the Public Health Promotion Commerce degree. We've got Dr. Claire Henderson Wilson, who's a senior lecturer in health and social development and teaches into the course and has taught into many of the units as well in the past. And then we also have Lauren Denali, who is our work integrated learning coordinator. If you would like to ask a question, then please type your question into the Q&A section in the question panel on this page, and we'll do our best to respond to all your questions during this session. If you have any unanswered questions at the end of the session, our team of experts are available on web chat all day to assist with any questions, including any specific international student-related admissions or fees or queries. So at the bottom right-hand corner of your screen, you'll notice a yellow chat now icon. So please click on this after the session to be connected with our team. So let's make a start in terms of our live Q&A. So our first question is, what are some of the career opportunities that come from this course? So this course, it provides you with so many skills around public health and health promotion, and you can really, in terms of career and your passion and who you want to work with and where you want to work, there's lots of scope. So a few examples are around community development, health education, health research, policy, planning, and program development. And there are close ties with other health sectors in terms of the work that those in public health and health promotion do. Our next question is best career opportunities after the Master of Health and Human Services Management course. So for this question, I'm going to throw over to Claire.
Thanks, Hayley, and that's a terrific question. I actually supervise a couple of graduates of that program that are undertaking their PhD studies, but some of the other more typical jobs that students graduating from that particular postgrad degree might go into include things like working for community health centres. They might go into healthcare associations, and some might even work in policy roles within government. In recent years, we've also had graduates work in a number of international agencies that have a presence in public health. Some of them are also divisions of general practice and health administration departments, including hospitals and associated networks. So quite a range that can come from that postgraduate Master of Health and Human Services Management. Back to you, Hayley.
Great, thanks, Claire. Our next question is, what's the difference between the Bachelor of Health Science and also the Bachelor of Public Health and Health Promotion? So some of you might have actually attended the earlier session, the earlier live Q&A on health sciences. So the two courses are different in their structure and in their core units, and also in the electives that then you have. So the electives are units that you're able to choose what you want to do. So for health sciences, there are lots of different majors that you can look at, whereas there are less electives in the public health promotion degree. There's more core units in terms of the skills really being aligned with public health and health promotion. The next question is looking at accreditations. So excitingly, the course has just got accreditation from IHUPE, which is the International Union for Health Promotion and Education. And this is a great addition for our course, that anyone who does the course will come out of it with this accreditation. Our next question is from Mel, and I'm going to throw over to Lauren for this question, and that is, where do the placements take place and at which stage of the degree?
Great question. So if you enrol in the Bachelor of Public Health and Health Promotion, you'll undertake the Health Practicum, and this is a core unit in your third or final year. So this enables you to undertake 120 hours of industry experience within a health setting. And there are quite a few different options for securing a placement. So you can choose to be allocated to a placement sourced by our team, the Health Work Integrated Learning team. And we liaise with a number of different organisations, including large health services, small not-for-profits, local councils, peak health bodies, and then also private sector organisations. So we really aim to source a nice variety of placements to align well with your interest areas. And just to give a bit of an example of some host organisations that students have completed placement with recently. So we've had Cancer Council Victoria, Monash Health, Inclusion Melbourne, the Murdoch Children's Research Institute, Casey City Council, Banyule Community Health, and then smaller neighbourhood houses like Banksia Gardens Community Centre. So that's just a really small sample. But yeah, there's a lot of organisations that regularly offer placements, and those organisations will vary year to year and trimester to trimester, just depending on whether they have a project or tasks available. Okay, back to you, Hayley.
Great, thanks, Lauren. Our next question is, can you complete majors within this degree? So you can, because you have enough electives. And so some students do complete a major and other students do a combination of different units. So if you're looking at a major within the health field, we've got things such as disability and inclusion, environmental health, family, society and health, health, nature and sustainability, psychological science, nutrition, and those are just to name a few. And they're a really good complement to the units that you do, the core units that you do in public health promotion. So like I said, some students choose to do a major, others might pick a few different units from different majors, depending on their interests, really. So a few options that you can do there. Question from Caitlin, and this one goes to Cindy. What has been the highlight of your degree so far?
Hey Caitlin, thanks for your question. I'd say the highlight of my degree is actually two things. One of them is the social aspect and social opportunities through clubs and societies. I'm part of the Health Promotion Society, and it's been a really great way to gain some professional development skills and also make friends with other people with like-minded interests. And my second highlight of my degree would actually be the amount of study spaces that Deakin has. Deakin's got a lot of really good study spaces in the central precinct, as well as the Winter Garden and the newly built law building. So yeah, they're my two highlights. Back to you, Hayley.
Great, thanks, Cindy. Our next question is from Ruby, and that is, would you suggest further study as being either necessary or helpful in securing employment? So in terms of future study, it's good to think about this early on in your degree, really just so that you know what all your options are. So in addition to masters, so we have different masters programs, so Masters of Health Economics, for example, if that's something that you want to specialise in. But further study also includes our honours year. And so our honours year is a year where students get to undertake a piece of research and they work with supervisors. So I've supervised students in the past, as has Claire, and it's a great way of building on your research skills that you get throughout your degree. Claire, do you want to share with us some more tips or the pros, I guess, of the honours year?
Yeah, thanks, Hayley. That's a great question, because we love working with honours students and really building their skills in research and aspiring them to potentially pursue even a PhD with us at Deakin. So it's a wonderful opportunity. Not only do you learn skills in managing a research project, you're learning some really valuable project management skills in general, which can be transferable to many organisations, being able to stick to a timeline, being able to undertake ethics applications and being aware of ethical conduct of research. These are all really helpful skills that I'm sure would be beneficial in a number of health promotion organisations. So it's a great opportunity. It can really allow you to extend the skills from your undergraduate 3-year degree and build upon those, certainly in the honours year, and then taking that forward into either the workplace or pursuing a further research career. So I have supervised a number of students over the years, and it's a really great experience for them, but also for me to be able to work and supervise them. Thanks, Hayley.
Thanks, Claire. And as Claire said, it's a real great opportunity for students to then follow their interests and their passions that they've developed throughout the courses. So, for example, I've supervised honours projects looking at women's health in particular. We've had students do honours projects that are also linked in with different agencies or organisations as well, because their supervisor might be working in partnership with that local council, for example. So definitely something to keep on your radar as you move through your degree. So our next question is, what are some examples of organisations that graduates have worked in? And this is probably a question that we can all provide an example of. So I know, for example, we've had past students move into local council, for example, in a health promotion role. And that was a position that they actually, that stemmed on from their placement as well. So Lauren, I might throw over to you. Have examples of the sectors that students have moved into?
Yeah, sure. So I do have a couple front of mind. So one is a student that undertook placement with La Trobe Community Health Services in the NDIS space. That's the National Disability Insurance Scheme. So she did a fantastic job, and her supervisor let her know that there was a position available. So she applied and was successful in gaining a role as a local area coordinator for the NDIS. So that was a great outcome. And then another one I can think of is a student that undertook placement with the International Nature and Forest Therapy Alliance, which, forest therapy is a bit of an emerging health promotion practice. So, they're looking at taking on lots of students and, really building their research base. So one of the students that undertook placement with them also did really well and went on to gain a paid position as a research assistant. So that was awesome. And I love hearing outcomes like that. It always makes my day.
Definitely. Claire, do you have other examples as well?
Yeah, they're terrific examples. I guess a few others that come to mind is certainly students that have gone on to gain positions in local government or sometimes even state government through their graduate entry programs, and quite a few that go into community health, whether it be in the inner city areas of Melbourne, or some have even gone out into rural and regional towns and also taken on the role of health promotion officers. And so forth. And the great thing is some of those students become alumni with our university, and they get to engage with us as staff members down the track, and we get to hear their success stories, and they like to come along and present to our students at forums and other activities. And it's always really nice for them to tell the current lot of students their experience of the degree and what it led to for them in terms of career outcomes. So it can be a really rewarding experience, and I'm sure it's something that Cindy's looking forward to pursuing very, very soon.
Thanks, Claire. As you say, it's really great when we can connect with past students and the work that they're doing and how that's linked to the course as well. Our next question is, what's it like studying on campus? Cindy, I might even throw over to you for this question.
Thanks, Hayley. Studying on campus is really great. After about 1.5, 2 years of studying online, it's very refreshing to be back on campus. The campus it's quite big, but I don't feel like it's too big, so that's a really good thing. And it's very lively and welcoming. There's a lot of study spaces that you can study individually, or if you're in a group assignment, you can study with friends. There's a lot of cafes if you're interested in studying at a cafe or even just catching up with friends. And one thing that I really like about the campus is our security and our Safe Zone app. So if for whatever reason you need security, all you have to do is press a few buttons on an app and they'll be there in an instant. Studying on campus is really good, and it's really nice to be back after studying at home. Back to you, Hayley.
Definitely. I mean, I think Claire and I can both agree with you there that it's nice to be back on campus as well. I guess just extending on that, how did you find the online learning environment, given that this course is offered as an online course as well?
Studying online was actually a very easy and seamless transition. In 2019, before COVID, I had already done a few of my classes completely online. And having that familiarity of the online resources, as well as Deakin's experience of offering courses online, was really helpful. So yeah, for me, there wasn't any issues transitioning to an online study. It was more a bit of an issue staying home all the time from lockdowns. So yeah, nothing to do with the actual study, but yeah, studying online is really easy with Deakin. And I'm actually quite glad I've had that experience, because now workplaces are incorporating more of a hybrid system of work. Yeah, so it's a really great experience, even though staying at home 24/7 wasn't ideal.
Thanks for that. It's also important, I guess, to note that we try and be as flexible as possible as we're moving back into almost a blend of on campus and off campus as well. So thanks, Cindy. Great to hear your perspectives on that. So the next question is, what makes this degree unique? So I guess, you know, my position as the course director, it really comes down to the skills and the content that's offered in the core units, but also the teaching team as well, the staff who take the units, who are experts in their field, and also the research that they do and how that links back in to the units that they take. Claire, you might want to have a chat about the research that you do and how that feeds into the units as well.
Very happy to do that. And in fact, it's World Environment Day today, so it aligns very nicely with the research work that I have a wonderful team that I work with, and we're part of the Health, Nature, Sustainability Research Group here at Deakin. And we also teach, as Hayley said, we teach a lot of our research, or embed that in our teaching, I should say. So a couple of our team members are involved in some really terrific units related to health and nature. So we have the core unit, Local and Global Environments for Health. We've had members of our team teach that for a number of years, and they really like to be able to incorporate some of the research we've done around the benefits of community gardens, for example, and also environmental volunteering. And just on that note, in reference to campus life, there is a terrific community garden at the Burwood campus that I've been involved in helping to set up over the years. And it's a wonderful space to go and refresh and rejuvenate, but you could also study over there too, Cindy, and other students that may have the privilege to study on campus at Burwood. So that's just something else that's relevant to our research. But yes, certainly the importance of environments for health, and it's really great to be able to bring our research into the teaching space. Thanks, Hayley.
And that question was a two-part question. So I'm going to throw the second part over to Cindy in terms of why study at Deakin. What made you pick Deakin, I guess? It would be interesting to hear about.
So I chose Deakin because something that really caught my attention was that Deakin is #1 in student satisfaction for quite a few years now. And that's something that really caught my eye, because Deakin has a lot of student support programs and initiatives. And personally, I've taken a part of some of them in my first and second year. And in my third and fourth year, I've actually been taking part of that as someone who's helping other people transition to Deakin. So yeah, like the support services are quite unreal. They're really helpful. And they've made it really easy to transition to Deakin, especially because I didn't know anyone. I live about an hour from Deakin, so not many of my friends came to the uni. But yeah, the Deakin environment and the Deakin support systems were really interesting to me. And yeah, it just really caught my eye.
Great, thanks, Cindy. Our next question. So someone has asked, could each of the panel members pick their favourite aspect of the degree? So Lauren, I might throw to you first.
Thanks, Hayley. Well, I might be a little bit biased, but I'd have to say that it's the health practicum and the work integrated learning unit. So I just think it's an amazing opportunity to build those skills and the experience that is required for future employment, including both, your transferable soft skills as well as those more industry specific skills. And it's a great opportunity to develop some networks and explore your career options and, what you enjoy and what you might not enjoy so much, but, it's all part of discovering, where your interests lie and what your passions are. And it's just something that really helps students to gain that competitive edge in the employment market. So yeah, I think having those discipline specific skills on your resume and those industry examples that you can refer to when you're writing cover letters and key selection criteria and attending job interviews, yeah, it's just something that really stands out.
Thanks, Lauren. Claire, I'll throw over to you.
Look, I think the strong focus on determinants of health is really important, and it's a really great feature of this degree. So whether they be the social determinants or the ecological determinants, there's also commercial determinants, and they go on, and they're all really critical to health. And I think that's really important because we teach students about that from their beginning of their degree right through to the end, and they can really see how they form the foundation of a healthy lifestyle and lead to strong health promotion action. And I think combined with the determinants of health is a focus on various health promotion models and frameworks that guide action. So one that we often refer to is the Ottawa Charter for Health Promotion, which was formed quite a while ago, back in 1986, before many of our audience were probably even born, but it's certainly a landmark document in health promotion that still guides practice today. And there's been various iterations that flow on from that, of course, but that's a really key model and a framework that a lot of our graduates would apply in their work role as well. So I think they're probably some of the key aspects that I think are really important, Hayley.
Thanks, Claire. And Cindy, what's your favourite part of the degree?
I actually have two. So as the health side of my degree, my favorite part is really learning about environmental and social health. That's a pretty big part of the degree, as well as planning and program evaluation. But overall, as a double degree student in health promotion and commerce, I'm majoring in marketing. And my favorite part about that is learning about how marketing really complements public health and health promotion, because as people, we are also all consumers of information and knowledge. And so it's really great to double my degree and see how all these marketing concepts still apply to public health, even though initially I didn't really see the connection. Yeah, so I'd say that's really been the best part of my degree as a double degree student.
Great, thanks, Cindy. Same as Lauren, I'm biased given that I'm the course director of public health health promotion, and think it's a great degree. So I struggle to pick one favourite aspect, I guess, of the degree. One thing I guess that I like about the degree is the content and how the content aligns together, and how you build on what you do in first year to second year to the practical skills that then you're enabled to put into action, I guess, at third year. And at the different years, you're offered different levels of support as well. So at that first year level, our staff are really understanding of the support that students need in welcoming them into Deakin and into the different learning spaces that we use. So, like I said, I'm biased. I like a lot of aspects of the course, but as Lauren said, the placement, it really gives students the opportunity to put their skills into action. We've had great success stories from the placement in terms of students then using their supervisor as either either a referee for a job or gaining employment from it. So they're just a few of my favourite aspects of the course. So if we move to the next question, it is, has the course content covered the pandemic? Yes, it has. It's been, the content is constantly updated in all the units to look at what are the current health issues at the moment. What do our graduates need to know when they're moving into the health field? Claire, I might throw to you in terms of your unit and links with the pandemic and recent health challenges.
Yeah, thanks, Hayley. I think it's important to know that we do try to take a bit of a strengths-based framework to all our content as well. So whilst we're looking at things like the pandemic, we are looking at the opportunities that can come from that in terms of opportunities for our graduates to work in the public health field. And we've also seen some of our recent graduates get jobs working in public housing estates where they've been part of vaccination programs related to the pandemic. So some of the units that I teach, they do cross over into the health sciences space as well, but they have covered on looking at sustainable and healthy ways to have a livable city going forward in light of things such as the COVID-19 pandemic. So how that might have changed the way we can operate. It's looking at things like the hybrid working model, how that can contribute to maybe more sustainable transport methods as well. Less people on the road, etc., those sorts of factors. So really trying to think a bit outside the box. I get students to look at plans that are in existence, whether it's through Melbourne City or other local government organisations. Maroondah City Council was someone we partnered with last year, for example, and the students have looked at ways to create a more healthy and sustainable future, but including aspects related to the pandemic. So I hope they're just a couple of quick examples to show different ways you can approach things like the pandemic.
Great, thanks, Claire. Cindy, did you have anything else you wanted to add to that?
Yeah, so bringing up the pandemic, in part of our degree, we've done a few units on epidemiology, which is very relevant to the pandemic. And we were really fortunate to actually have Catherine Bennett come and guest lecture for us. And so, as a lot of people know, she's been on TV a lot talking about the pandemic, and she's got a lot of expertise in this area. So she came into our class online, and she guest lectured about how the things we have learned can be applied to the pandemic. So it's quite great to be able to have Catherine Bennett come lecture for one of our classes.
Great, thanks, Cindy. So Catherine Bennett sits in our School of Health and Social Development. So great that you can see the links in terms of what's, the current happenings and how that is then integrated into your course. We're almost at time. We just have time for a few more questions. So the next question is, which areas of industry or which areas in industry will be in high demand in the next few years? So Lauren, I might throw to you to that in terms of placements even.
Yeah, so I think as you were saying, in terms of COVID, I've noticed that a lot of, the placements coming in and the projects that organisations are offering are related to community engagement and community development. So a lot of health organisations and, councils and neighbourhood houses are really looking at how they can, re-engage communities and reconnect them, after such a long period of being isolated. So I've definitely noticed a lot of work and a lot of positions being advertised along those lines. I think disability and inclusion, women's health, prevention of violence against women, they're always really popular or common areas of employment. Our team actually manages a LinkedIn employability group for public health and health promotion students and health sciences students. And every day we post job opportunities. So if you enroll in this course, you'll have access to this resource, and it's a really great way of staying on top of industry trends and the different position titles and the breadth of roles that are out there and are in demand. So yeah, that's a good one to keep an eye out for.
Great, thanks, Lauren. Did you have anything to add, Claire, in terms of future industry needs?
No, I think Lauren's covered it nicely there, but certainly there'd be a lot of growth opportunities for our public health and health promotion graduates in light of what's just been covered.
So our last question, our last question is, do students pick electives outside of the health field? And I can jump in here and say, yes, they do. There's many different electives that students can pick from. So we've had students, pick from arts and education, for example. So with the electives, there really is scope to tailor the degree in terms of your passion and what you would like to cover. That being said, there are plenty of options within the Faculty of Health and within those, even in those majors that I highlighted at the start as well. So unfortunately, that's all we have time for today. So thank you for joining us. It's really great to see so many of you interested in the public health promotion space and to receive so many questions. So thank you for your time, and we hope to see you at Deakin soon. And thank you to all the panel members for today as well.